Welcome to 20 Years of Gendicine, which is the title of today's talk. It's an approved gene therapy for treatment of cancer and also widely being used for the prevention of cancer. It's a recombinant adenovirus with a p53 suppressor gene. What is gene therapy? Gene therapy is a technique that modifies a person's genes to treat or cure a disease. Gene therapies can work by several mechanisms. For instance, by inactivating a disease-causing gene that is not functioning properly, and thereby allowing the introduction in replacement a new or a modified gene into the body to help treat a disease. What are some types of gene therapy? Plasmid DNA, which involves circular DNA molecules that can be genetically engineered to carry therapeutic genes into the human cell. And more relevant today to today's topic is viral vectors. Viruses have a natural ability to deliver genetic material into cells. And therefore, some gene therapy products are derived from viruses. But obviously, the virus needs to be modified to remove their ability to cause infectious disease before they can be used. And these modified viruses can be used as a vector or a delivery vehicle to carry therapeutic genes into the human cell. There are bacterial vectors as well, which we will not dwell into. And lastly, human gene editing technology. The goal of this gene editing technology are to disrupt, harmful genes or to repair mutated genes. What are some gene editing methods? Number one, meganuclease. Number two, zinc finger nuclease. Transcription activator light effector nuclease or TALEN. And the most popular is CRISP or clustered regularly interspaced short palindromic repeats. And basically, it's like a scissors. They go to the segment of DNA where there's problem, they cut it, take away the mutated gene, insert a new modified therapeutic gene, and there you go. What is cancer? This is very relevant to Gendicine or p53 gene therapy because it's approved for the treatment of cancer and widely used for the prevention of cancer. What is cancer? Well, firstly, let's talk about genes. Our genes determine the health of a human being because the genes determine our life, it determines our metabolic function, it determines our repair mechanism, it depends our cell replication and so forth. Because everything about life is encoded into our gene or our DNA. Oncogenic versus cancer suppressor. See, on one hand, you've got the accelerator of cancer. This one is the car brake, okay? So oncogenes are genes that have been mutated and have the potential and ability to cause cancer, such as these ones on the right, RAS, SRC, ERB. On the other hand, to counterbalance, you have tumor suppressor gene or cancer suppressor gene, like p53, p21, retinoblastoma gene, and the WT1 gene. Causes of gene abnormality. Diet, the polluted water and air we breathe, ultraviolet light, radiation, and these are known to be able to cause genetic mutations, which can lead to complications like cancer and metabolic disturbances. Hereditary. Cancer does run in families, that are hereditary lines that will cause you to have a higher risk of cancers. Unusual, I wouldn't say unusual, but we know that some viruses can insert their genes into human cell genes, thereby introducing tumors, such as the HPV virus or human papilloma virus that causes cervical cancer, EBV or Epstein-Barr virus that causes laryngeal or throat cancer, and hepatitis B virus that causes liver cancer. Okay, this is more relevant to tumor suppressor genes like p53, for instance, in this case. Normal chromosomes, maternal and paternal. We get half of our DNA information from our mother and half from our father. So here you go. You got two functioning proper tumor suppressor gene. And p53 is an autosomal recessive gene. Thereby, if you got one that is mutated, but one that is still functional, overall, your p53 function is still intact. But if it's autosomal dominant gene, you only need one to be non-functional and the whole thing collapses. Your p53 will not function. But p53 is an autosomal recessive gene. But given that if you have a second hit, there'll be no functional tumor suppressor left, and thereby a lot of problems and sequelae can occur. Now we talk about cancer and gene mutation leading to cancer and various chronic diseases. So on your left, you've got your normal cells that are not mutated, but slowly over the years, there's bound to be some environmental insult, internal injury that can lead to your cells' genetic material to mutate. 5 to 20 years, if you are not well, if your immune system is suppressed, cancer cells can accumulate and multiply. We know that every day, 5,000 to 6,000 cancer cells are being produced in our body. It's just that our immune system is there to mop it up, counteract it, right? Like our natural killer cells, dendritic cells, and so forth. And if your immune system is overwhelmed or suppressed, the cancer can actually result in symptoms and even cancer metastasis. I mean, the cancer can spread. So in terms of monitoring your genes in relation to cancer prevention, you can do it for primary prevention. If you are high risk, secondary prevention, you still check your p53 status. And for tertiary prevention, we can monitor it and also monitor your p53 status, even if you're already on chemotherapy or radiotherapy, and use p53 therapy to augment your radiotherapy and chemotherapy treatments. So the most important defense against cancer is your p53. p53 is what you call the guardian of the genome. They are like the quality control of your genes, okay? Because when you multiply cells, when your cell is dividing, there will be replication of your DNA material. But if the origin is mutated, you obviously use an aberrant or mutated cell with a mutated DNA, and you don't want that. So a quality control, like for instance, in a factory production line, right? So that quality control checks all the way. If something is aberrant, the product is wrong, it's not to specs, the quality control is there to stop it and to find out the reason, and then to ameliorate and remedy the reason. That's exactly the role of p53 tumor suppressor gene. In this publication, Kuma published in the Robbins and Kettering Pathological Basis Disease, it states that the most profound and the most important anti-cancer gene known to human is p53. p53 regulates thousands of genes, and its pathway has remained unchanged throughout billions of years of evolution. And the top 10 most studied genes of all time are described in more than 40,000 papers. And p53 has more than 8,000 citations. So it's the most researched, most well-studied gene or tumor suppressor gene in human history. What does p53 does? What are its major functions? P53 monitors for cellular damage. It monitors your DNA for damage, indirectly monitors cellular damage. And if the cell is damaged, the DNA is damaged, it freezes the cell. It just tells the cell, please don't multiply. It's just like being a QC control in a factory. Oops, it's not to spec, stop, find out why, and then go and fix it. So if it detects that, it will get the enzymes to repair the cell by repairing the DNA. And it's repaired, fine, continue to multiply, continue to divide. But if it's the gene, that damaged part or the mutated part is of the DNA is beyond repair, then it causes apoptosis of the cell, because you don't want a potential mutated cell to cause tumors, right? So it will just tell that particular cell to die. And how does it do it? It signals molecules into the mitochondria of the cell. Mitochondria is the power supply of the cell to shut down. So when you have no power supply, the cell will just naturally die, and thereby the term apoptosis. Okay, to further illustrate this is a cell cycle. I mean, a cell cannot be multiplying non-stop, right? So this is the GO phase, where the cell is arrested. It's in senescence. It doesn't multiply. It does nothing. It's just in a rest phase. G1 is the growth 1 phase. S phase is the DNA replication phase, whereby the cell accumulates and gathers proteins for DNA replication. I mean, it's one cell. Before it can become two cells of the same size, same function, it must accumulate materials to do that, right? To make another cell. G2 phase is when it gathers materials, proteins, to divide into two for cellular division, right? I mean, you need new membranes, you need a new cell membrane, you need cell DNA, and you need proteins. And there you go, cell division, and then the cycle goes again. So what P53 does is that if it detects DNA damage, it will just freeze the cell at G1, just stop progressing to S phase, right? And then it will ask for the cell DNA to be repaired or to go into apoptosis. There you go. Okay, P53, which, as I mentioned, can be mutated by many insults. I won't go into it. I've already explained. But its function is to regulate the cell cycle. If it finds a DNA that is damaged, it will just arrest it, ask the enzymes to come and repair the DNA. If it's irreparable or cannot be repaired, it will ask the cell to go to autophagy, which is programmed cell death, by various means like ferroptosis, apoptosis, and necroptosis, which I won't delve into further. Okay, this is a study published in The Lancet in 2016, a reputable medical journal, entitled Biochemical and Image Surveillance in Germline Tumor P53 Mutation Carriers with Li-Fraumeni Syndrome. It's an 11-year follow-up of a prospective observational study. I mean, it just looks forward, follows these people 11 years. And Li-Fraumeni syndrome is a hereditary disorder whereby you have a mutation in your P53 and leads to a high risk of cancer. And people with Li-Fraumeni syndrome, by early adulthood in their 20s, they would have already had some sort of cancer. So this underscores the importance of P53 in cancer prevention. Okay, this is another study by Baslan and Morris, published in Nature 2002, only 2 years ago. They conclude that P53 deletion leads to cancerous phenotype. We all know that. On the basis of P53 deficiency, due to genomic instability and progressive loss of control, cancer eventually develops, and this pattern is predictable, orderly, and deterministic. This is a study of over 10,000 patients in China with cancer, 10,194 to be exact. And they found in these people who already have cancer, 58% of them had a p53 mutation. So this is quite significant. So mutation data on genes in China confirms the importance of p53 in regulating our cells. Importance of genetic health. The International Agency for Research on Cancer on the World Health Organization indicates that the development of cancer requires a fundamental condition, namely the inactivation of tumor p53 gene. If the tumor p53 gene functions normally, cancer will not develop. So I've had exosome therapy, mesenchymal stem cell drips. So I'm telling my friends that I've already gotten my cells and my organs to be age 30 or even younger. But now with p53, I can get my genes to be age 30 or younger. Isn't that a revelation? So all individuals aged 30 and above should undergo testing for a health status of their p53 anti-cancer gene, as per the International Agency of Research on Cancer of the World Health Organization. This is a study by Dr. Mikulesh, which I found on YouTube. His YouTube channel is called Mirror Genomics, which I will add in the description, the link into the description in this video. You can go and click on that. He was sharing a case report of acute lymphoblastic leukemia, lymphoblastic lymphoma following a second dose of Comirnaty vaccine. In Malaysia, Comirnaty vaccine is also known as the Pfizer vaccine. And it's an analysis of potential pathogenic mechanisms based on existing literature. So this is a study that reviewed how this Comirnaty vaccine, how does it lead to cancer based on existing literature.
So there is clearly some background information. This is probably the best review I've seen summarizing all of this, which is why I wanted to bring this to your attention. But how the authors finalized this was basically giving us suggestions as to what might be causing all of these. Why are we seeing cancers after vaccination? And by the way, some of these show up very quick, like within few days after vaccination, so very rapid onset. Most of them are de novo, and that means basically there was never a history of any kind. There was no prior cancer. It just shows up out of nowhere type of thing. And so you can see that there's definitely, this suggests that there could be some sort of a causative effect. So now let's talk about the potential causes that the authors proposed, because this was very, very fascinating as well. So number one, they're talking about the potential of vaccines inducing these molecules called PD-1 or PD-L1 on the surface of immune cells. PD-1 stands for programmed death 1. I talked about this extensively now in multiple videos, but basically, when you have these molecules on the surface of your immune cells, it signals these molecules basically to no longer work as effectively. So they're going to be shut off. This is part of what is referred to as the induction of this concept of called T-cell exhaustion. So check out some of the past videos where I've talked about this already as well, and I went deeply into this topic in my turbo cancer videos as well, all right? So that was the first one. The second one was the possibility of the spike protein of interacting with tumor suppressor proteins, so proteins in our body, in our cells, that normally are supposed to make sure that cancers do not develop. the tumor suppressor. So p53 protein is one of them. BRCA1 is another one, or BRCA2. So these are important proteins in our body that work in such a way to make sure that cancers do not develop. And apparently, spike protein, there is now some supporting evidence that spike protein could be interacting with these proteins and perhaps limiting their proper function, okay?
Okay, so what he's saying, the authors of that study is saying that the spike protein from the vaccine interferes with the functioning of p53 and other tumor suppressor genes, and thereby limiting its effectiveness, and thereby it's probably a pathogenesis or mechanism that leads to cancer. Yeah. The journey to a cancer-free era starts with p53 anti-cancer gene. Okay, so testing for p53, there are various tests available. cfDNA testing is the one that we do use. The advantage is that it measures 6 locations on your chromosome. Some other tests just measure about 3 locations. And besides that, the cfDNA, it's a qualitative measure. That means, yes, you have mutation. No, you have no mutation. But it also measures it quantitatively, so the degree of your mutation. Where some of the other tests, it's just qualitative, yes or no. So the advantages of cfDNA testing is that it has 6 locations where it measures for mutations. Here's a typical test. For instance, 1, 2, 3, 4, 5, 6 loci or locations. You can see in the second location, there's a score of 2 there. 2 aberrations. And red means high risk of certain diseases. If it's a lighter color, like yellow, it's a lower risk. So this is the product, Gendicine, and here you go. For cancer prevention, it's basically using a nebulizer for 30 minutes. You breathe it in, inhale in, and from the lungs, it will just go through the whole body. For cancer treatment, it depends on the location. If it's breast, you just inject it directly into the breast. If it's other parts, it can be directly to the tumor, or you use it by intra-arterial means or intravenous means. And it can be used in conjunction with existing chemotherapy, thereby reducing the dose required even, or radiotherapy, reducing thereby the even frequency of radiotherapy, and thereby overall improving the outcomes of these overall treatment. This is a study by Harvard, Kim, entitled Tumor p53 Gene Therapy as a Potential Treatment for Patients with COVID-19. I mean, the COVID-19 virus, not the vaccine, the virus, can interfere with p53 suppression, right? Thereby leading to a lot of complications and so forth. There you go. If you get the COVID-19 virus, it can cause p53 degradation and mutation, and leading to difficulties in repairing cell damage, leading to sharp increase of cancer. So what you can do, just go for a p53 nebulizer, help repair the genes and repair damages that has already been caused by the virus, which is basically overall a part of the gene health management mechanism. This is a report before and after intervention. This is before on this side, and on this side is after. You see, at the second location where you had a score of 2 on the second location, there you go. It's gone to 0. So there's no more mutation at the site. And instead of being all red, it's gone to yellow. So the risk profile for diseases have been lowered by 1 round of prevention of p53. The benefits of gene health management. Yes, when we first started 20 years ago, we were using cell therapy, right? That's just cellular level. Then we've come down to a molecular level, like secretomes and exosomes. But now, therapy has come down to a genetic level. So now I'm talking about the benefits of gene health management. Okay, so yes, it's important to look after your cells. It's important to look after your macromolecules, but now it's also important to look after your genes. Because why? P53 can also enhance antiviral capabilities. Remember, I said the genes determine your life, not the cells, your genes, right? Not your organs, it's the genes. Enhance cell vitality. P53 is proven to lengthen your telomere, reduces the risk of chronic disease complications, reduces overall cancer risk, and precise cancer prevention, whereby it's measurable, quantifiable before and after treatment. Some P53 testimonials. This is a person with low immunity, manifested as shingles and susceptibility to colds. Symptom disappeared after intervention, and 3 years have passed, and the shingles have never reoccurred. And I actually know this person. There's another person who was easily fatigued, lack of energy, but the symptoms disappeared after a few rounds of P53 intervention. 3 years have passed, and the person have recovered. Recently, I met a 78-year-old uncle in Bukit Batajam. He was sharing with me that after 3 doses of Pfizer vaccines, he's just never felt the same, despite whatever therapy he's been going. He said he's just been so tired, and whatever therapy has been given to him has not worked. So he's a perfect candidate for P53 gene therapy. There's another person with a history of familial tumors with P53 mutation. After intervention, the mutation site disappeared, reducing the risk of cancer. And it's been 1 year since, and the mutation has not reappeared. Another patient with family history of tumors with alpha-fetoprotein levels persistently at 15 times the normal value. After intervention, alpha-fetoprotein levels returned to normal, and it's been 4 years since, and the level has not rebounded. Another patient with hepatitis B, virus levels were persistently abnormal. After intervention, they returned to normal, and it's been seen 2 years since, and it has not relapsed. This is a cancer patient with type 1 diabetes requiring insulin injections. Insulin treatment was discontinued after P53 intervention, and has been off insulins for 10 years. There's another patient with post-COVID-19 and ended up with myocardial injury, asthma, and fatigue. After intervention with P53, the indicators returned to normal and the symptoms disappeared. And it's been 6 months since, and the patient still has not relapsed and has recovered. So, to put in an overall frame, primary prevention, healthy individuals like me and you go for genetic condition screening, just measure your P53. And if it's normal, no need intervention. If it's some mutations here and there, you can consider P53 intervention. Secondary high-risk individuals, I mean, those who are sick, who has diabetes or whatever, chronic inflammation, same thing, do a P53, and you can treat as prevention. But for those who are diseased, genetic therapy for cancer and for cancer patients, it can help prevent relapse of your cancer. You may have cancer, treated with chemotherapy and remission, but P53 will reduce the risk of recurrence or relapse of your cancer. And obviously, in doing treatment, it will also help in combination with other modalities to treat cancer and improving the outcome of treatment. So 1/3 of cancers can be prevented, 1/3 can be diagnosed early and cured, and 1/3 can have their pain alleviated, those with cancer, and their life extended. Some relevant information, Rhyton gene, that's where you can do your p53 screening with the 6 locations, the CNF DNA. Gendicine, the world's producers of the world's first gene therapy for cancer, and that has received regulatory approval for market launch 20 years ago. Currently, the world's only gene medicine for treating cancer, pioneering a new era in human gene therapy for disease and leading the world so far. So what is the procedure? You take a blood sample, then we send it. You can do it in various destinations to collect the sample. Then we send it to the lab. In 3 to 7 days, you get your report. And based on your report, we can do an intervention plan. If intervention is not required, then we just leave it. Or if we feel there's a mutation, we will recommend intervention. We use a nebulizer for 30 minutes, inhale it in, and from there it will just go out through the body. For 30 minutes, here you go, 3. And at 25 to 30 days, you do a repeat blood test to see whether your p53 status has improved. That's the procedure and protocol. So, in summary, Gendicine has been approved in various countries for gene therapy for the treatment of cancer, and also has been widely used for the prevention of cancer. But it's also very good for regulating the overall body metabolism and the overall balance of the internal milieu. And it's been widely published. Here's a reference here. So thank you and have a good one. Thank you for listening.